Good morning, everyone. I am really excited to welcome you to Penn LDI's annual Charles C. Layton Lecture. I am David Grandy. I'm LDI's Director of Policy. Before we get started with our speakers today, I do want to share a little background with you on this annual lecture. Since 1994, this annual lecture has honored the memory of the late Charles C. Layton through a generous endowment from the Merck Company Foundation. Dr. Layton was Senior Vice President of Administration, Planning, and Science Policy at Merck Research Laboratories for nearly 3 decades, where he was responsible for the international regulatory approval of drugs for Merck. The following video was created by his family in his memory, and we'll share that right now.
Hello, my name is Pamela Layton, and Charlie Layton was my husband. I am so proud of this lecture given by the grant from Merck & Company to honor Charlie and his contributions to Merck for 28 years. The first Layton lecture was in 1994, and Dr. David Kessler, who was then the head of the FDA, was the first speaker. It was very appropriate as Charlie had worked with Dr. Kessler personally. At that time, it took 14 years for a new drug to be approved by the FDA. In 2021, President Biden appointed Dr. Kessler to serve as the Chief Science Officer of the COVID-19 response team. What seems really remarkable is that Pfizer, Moderna, and J&J were able to get their drugs approved so rapidly for the pandemic and with such high efficacy. Now we have boosters available. I would like to introduce my 3 children, Wendy, Christy, and Chip.
I am Wendy Layton. My father believed in equal access to medicine and high quality healthcare for all people, including those from marginalized groups. He would be thrilled with Congresswoman Lauren Underwood speaking today for the memorial lecture. She is a pioneer, the youngest African-American to serve in the House of Representatives when elected, an advocate for Black maternal health care and ending disparities, an ally for the next generation, especially women in the Black and LGBTQ communities, and a strong supporter of addressing the gun violence epidemic. My father was also a pioneer, a graduate of Harvard Medical School who worked his way to be a top researcher scientist at Merck, an advocate working with the FDA for approval of drugs to treat AIDS, a passionate scientist who traveled the world promoting cutting-edge medicine, vaccines, and healthcare for all. He truly loved working as Senior Vice President of Medical and Regulatory Affairs worldwide. To me, as his daughter, he inspired me to find my passion in life as he had found his.
Hello, my name is Christina Layton, and I'm a teacher from Erie, Pennsylvania. I know my dad would be very excited to hear our guest speaker, Congresswoman Underwood, today, as he shared some important connections with her. The first being the issue of health equity for all. During his long career at Merck, my father played an integral role in providing life-saving medications to communities all over the world, regardless of their race, socioeconomic level, or ethnic background. In addition, he would have given enthusiastic support to the efforts of Congresswoman Underwood in the Department of Health and Human Services, providing assistance to those who endure natural disasters and public health emergencies is of tremendous importance since the beginning of the COVID-19 epidemic, as well as recent climate change. Finally, as a father of 2 daughters, I know he would fully support the initiative of improving maternal health policy, especially for Black women. We are delighted to have Congresswoman Underwood speak at our Father's Memorial Lecture today. Thank you for being a part of it as well.
My name is Chip Layton, and I'm the youngest of Charlie Layton's 3 kids. I know my dad would have been so pleased with this lecture series. He was an advocate for science and also a big proponent of education. So I'm sure he's been looking down and smiling at all the wonderful lectures here over the last 28 years. And I know he'd be excited about this year's lecture too. Congresswoman Underwood's efforts to expand access to healthcare would have been of great interest to my dad, who worked so hard during his career to achieve similar aims. And as someone who loved the outdoors and got involved with me in youth scouting and similar activities, I think he would love that she's a lifelong Girl Scout. Thank you all for joining today.
Once again, I want to thank the Leonard Davis Institute for their efforts over 28 years to recruit such renowned speakers with distinguished careers in the field of science and medicine. It is indeed an honor working with you and my family. I look forward to today's second virtual lecture.
All right, I want to share a very special thank you to the Layton family for that tribute and their support for this important annual lecture. And I have no doubt, as you just heard from them, that we will be treated to an outstanding lecture today from a national leader in health policy. Let me go ahead and introduce our speaker for today and our moderator. So first, let me start with Congresswoman Lauren Underwood. As you just heard, Congresswoman Underwood serves Illinois' 14th Congressional District. She was sworn into the 116th U.S. Congress on January 3rd, 2019. Congresswoman Underwood is the first woman, the first person of color, and the first millennial to represent her community in Congress. She's also the youngest African-American woman to serve in the United States House of Representatives. She serves on the House Committee on Veterans Affairs and the House Committee on Appropriations. Congresswoman Underwood co-founded and co-chairs the Black Maternal Health Caucus, which elevates the Black maternal health crisis within Congress and advances policy solutions to improve maternal health outcomes and end disparities. She also serves on the House Democratic Steering and Policy Committee. So our conversation with Congresswoman Underwood will be led and moderated by Antonia Villaruel, who is the Margaret Bond Simon Dean of Nursing at the University of Pennsylvania School of Nursing and director of the school's WHO Collaborating Center for Nursing and Midwifery Leadership. And as a bilingual and bicultural nurse researcher, Dr. Villaruel has extensive research and practice experience with diverse Latino and Mexican populations and communities, health promotion, and health disparities research and practice. So my next move here is to get out of the way and let Dean Villaruel lead us in this great conversation today. So thank you to both of you.
Great, thank you, David. And let me extend my thanks to the Layton family for their kind words about the Congresswoman and also for putting in context the impact that their father had on health and healthcare. And we are honored here at Penn to be able to honor him in this particular way. Congresswoman Underwood, welcome to Penn. It's not the first time you've been to Penn and not the first time you've been to Penn virtually. And I'll look forward to the days that we can have you here on campus. But for now, just absolutely welcome. We're looking forward to this conversation.
Thank you so much for having me. I'm so grateful to be with you today.
Great. So Congresswoman, I am so enthralled by your story, and it's been such an inspiration to so many. And I think everybody knows your story, but not everybody does. So I would love for you to start as, again, someone who is so young and who was so focused in her earlier part of her education as to what she wanted to do. I think you told me that you wanted a federal appointment to run a major DHHS agency, and then you moved off. So this isn't exactly where you ended up, but it's not too shabby of a second place. So tell me about the inspiration. And I think some people might think, well, it's a strange role or vision for a nurse to have. So tell us a little bit about that.
Well, I began, I guess, when I was diagnosed with a heart condition in 3rd grade. It was at a swimming lesson. I got nervous, my heart started racing, and it just stayed at an accelerated pace. And I ended up getting diagnosed with supraventricular tachycardia and had to go and see my cardiologist and medical team very frequently. And that's what really put me on a path to becoming a nurse and really focusing my interests in healthcare. When I was graduating from high school in 2004, it was around the time of the landmark Institute of Medicine report, Unequal Treatment. And there was a lot of focus and discussion about health disparities. We didn't really call it health equity back then, but that's what it was. And when I just made the great decision to attend the University of Michigan, I was sort of on this track to become a nurse researcher, basically. I would not have articulated it in that way, but with the great keen guidance and eye of faculty like Dr. Villarreal and others, I was put into these positions to learn about some of the leading disparities in our country. I was very intrigued by the disparities in the maternal health space, more specifically preterm birth, infant mortality. And, you know, I worked very closely with Dr. Villarreal on my senior honors thesis project, which looked at Medicaid reimbursement rates for nurse midwives. And I was just on this path of, you know, trying to figure out my place in helping to improve population health in this country. I went on to get a master's in nursing and a master's in public health from Johns Hopkins, and ended up working at the Department of Health and Human Services to implement the Affordable Care Act. Anything the Obama administration was getting sued on related to the ACA was in my portfolio, and I loved it. I worked on private insurance reform and healthcare quality and Medicare, preventive services, those free screenings and vaccines and contraceptive coverage. I was really proud of the work that we did to extend healthcare coverage to the first time for nearly 20 million Americans. And then ended up joining the Obama administration, where I worked on public health emergencies and disasters. We did Ebola, Zika, the water crisis in Flint. We were working on bioterrorism threats, and it was fast-paced, it was exciting, took me around the world, and I was really pleased to have the opportunity to serve at a time when it felt so consequential, and we were really beginning to have a national conversation around equity in disaster response, and how we can help prevent deaths and disproportionate impact on vulnerable communities. I served in the administration until the very last day, but I did not want to stay on and help the Trump team take away healthcare coverage from people. They made it immediately clear that they were going to seek to repeal the Affordable Care Act. And so I moved home to Illinois. I began working for a Medicaid managed care plan in Chicago. And I just happened to go to a town hall that my then congressman hosted in the spring of 2017 during the time of Obamacare repeal. So you probably remember that spring, there are many different proposals under debate and discussion. But at that town hall, my congressman said that he was only going to support a version of repeal that let people with pre-existing conditions keep their healthcare coverage. So I'm this nurse who had worked on the ACA and had a pre-existing condition. And so when I heard that affirmative statement, I believed him. And then 2 weeks later, he voted for the American Health Care Act, which was the version of repeal that did the opposite. It made it cost prohibitive for people like me to get affordable care. And I got really mad and decided, you know what, I'm gonna run. And I think we all have these big ideas, you know, write a book, start a business, start an organization, and then life happens. But I just couldn't let this go. And so I ran and I won and became the youngest Black woman to serve in Congress.
So Congresswoman, what's remarkable about the run, other than, we could talk about this part all the time, but there's so many incredible things that you've done that I want to get into as well. But you ran in a heavily Republican district where you probably had zero name recognition. So how was it that you were able to, as the first Black woman, I don't know what the racial makeup is of your district, but I can imagine what it is, because I know you have some rural areas either. So how were you able to cross those barriers and to get people on board with you?
Yes, my district is outside of Chicago, half suburban, half rural. It's about 80% white, maybe 10% Latino, about 6-7% Asian, Indian, Pakistani, mostly in the Asian community, and then less than 3% Black, okay? So when I got on the scene, people were like, oh, that's nice, good luck. And what we found is there was a lot of people, particularly in 2017 and 2018, when, you know, the partisan divide had ugliness to it. And they felt like they couldn't talk to their neighbors or their family members about these issues that were so important to them. And so we showed up, knocked on their door, and listened to their concerns, engaged them with substantive ideas for how to improve the quality of life or solve problems that were really prevalent across our community, and found a broad base of support, even in the most conservative leaning rural areas. In that campaign, I won every county in the district, and there's 7 counties, including the brightest red spots. One of the things I found most interesting is that the farmers, their #1 issue in the 2018 campaign was healthcare. The Farm Bureau's #1 issue was trade. And so most of the folks seeking election would only talk to the Farm Bureau and miss the opportunity to connect with the voter about the key issue for them in that election. I brought, considerable experience and perspective on healthcare, and was able to really build trust with those voters about our proposals to lower their costs, improve the quality of care, and to end disparities.
So, as you're talking about your running and winning in that district, I see lots of parallels from what you've been able to do in Congress, specifically around the Momnibus bill.
Yes.
And I would love to hear, I think there's 2 areas that I'd like to be hear about. #1 is how you amassed your congressional colleagues, but 2, how you involved some of the grassroots professional organizations, women of color, women who care about reproductive rights and women's well-being in there. I think those were, maybe they were separate, maybe they weren't, but those are 2 maybe different constituencies that I bet had different strategies. So I'd love to hear about that.
So in the spring of 17, I was still grieving the loss of a good friend of mine. Her name was Dr. Shalon Irving. We were classmates at Johns Hopkins in my master's program together. And she had just given birth to a beautiful baby girl, her first child, her daughter named Soleil. And 3 weeks later, she died from complications related to high blood pressure. And so 3 weeks after delivery, she died. And so it took this, theoretical or fact that we had learned in school about maternal mortality, and it really made it real for me. I knew that if I won my election, this would be an issue that I wanted to work on in the Congress. And so I teamed up with Congresswoman Alma Adams. She's from North Carolina. Congresswoman Adams was a senior member on the Education and Labor Committee that I served on in my first term. And she had some experiences with severe morbidity through her daughter, Janelle, who had a really complicated pregnancy. And so we decided to work on this issue to end our nation's maternal health crisis. But because it's Congress, we gave ourselves a name, right? And so we called it the Black Maternal Health Caucus. And the day that we launched, I was stunned. I have to be really candid with you. I thought it was just going to be Alma and I working together on this issue. All of a sudden, the majority leader shows up at the press conference, right? We have some very senior, influential members of Congress who are at the press conference with us. And I was like, wow, I don't really know what's going on here, but this is great. And then as soon as that press conference was over, introducing the Black Maternal Health Caucus, the phone did not stop ringing. We were hearing from academic researchers, providers, those grassroots, Black women-led organizations around the country who were so excited to finally have a way to plug in to the federal government to share their findings, their best practices, in the hopes that we could do something at scale to save moms' lives. It's really important that even as clinicians, this is a disparity that we've long known about, that Black birthing people are 3 to 4 times more likely to die of pregnancy-related complications than their white counterparts. For Native American and Indigenous people, 2 times more likely to die. For every death, we have 70 near misses, and this disparity has been around for decades. I think the part that clinicians might not have really focused on is, while this has been happening as sort of a clinical phenomenon, we've not seen large-scale federal intervention. No policy shifts specifically designed to end this disparity. Meanwhile, the United States maternal mortality rate is just ticking up. We are leading the industrialized world. And so this was really the first time that we had a federal initiative. And it was us, Alma and I, in the Congress. And so we immediately started hearing from all these folks. We organized the Stakeholder Summit. And at that stakeholder summit, we invited to the Capitol folks from around the country. And that is what generated, that was the genesis of the Momnibus, which is now 12 bills, evidence-based, data-driven pieces of policy designed to end our nation's maternal health crisis. So we're focusing on social determinants. We're focusing on leading causes of death like mental health, substance abuse, suicide, addiction. And then, you know, recognizing this environment of incredible innovation and activity to expand access equitably to those technology tools. To build the support within the Congress, right? We are now one of the largest bipartisan caucuses on Capitol Hill. What I found is even among my Republican colleagues, many of them had deeply personal reasons for caring about this issue and had not had an opportunity to really express their support for solutions or to really engage in a really direct way on this issue. And so we have, you know, a handful of really involved Republican men and women from across the country who are either, you know, senior Republican co-sponsors of our bills, which make them bipartisan, or active within the caucus. And it's been a real honor to be able to identify this as an area for bipartisan cooperation. And I think it gives those advocates and leaders around the country at the grassroots level comfort and hope to know that this is not just a political exercise, right? That help is on the way and that we have solutions with broad buy-in.
So Congressman, what do you think was the recipe? I mean, was it a topic that people cared about? Was it tangible solutions? Was it grassroots? I mean, what's the lesson learned, and how might this be applied to some other related issues?
Well, I think there's a few lessons learned. I think you are absolutely right with the factors that you mentioned, but also representation matters. And so I got sworn in at 32, the youngest Black woman. You know, there had never been anyone like me in the Congress before. And so I think that, you know, people assume that the Congress works on those issues that are most important, most consequential for the American people. That is not true. The Congress works on the issues that the members raise. The members are who set the agenda. We write the bills. We call the bills to the floor. We set the floor schedule, what gets a vote, what doesn't. And so I think that we have, you know, at this point in time, the Congressional Black Caucus is the largest it's ever been in history. There are more Black women serving right now than have ever served concurrently in history. We have now crossed the threshold of over 50 Black women having been elected to Congress in all of America's history, right? Over 400 years. And so, you know, in that historic context, I think it helps explain why we could have this burst of energy and impact within 3 years of founding of the caucus. I mean, we've had significant appropriations directed to programs that have interventions in the states that have been proven to work. We've had one of the Momnibus bills be signed into law, my Protecting Moms Who Served Act, which is helping our veteran moms. And then we've seen 80% of the Momnibus included in that large, we call it reconciliation bill, Build Back Better, that passed out of the House, that we're still negotiating in the Senate. And so, you know, I think that there is an opportunity for people to share their own stories in an authentic, passionate way. And I use the word passionate because you have to bring that emotion to the work. That's what people connect with when they know that you're sincere. And I try to bring joy to this work, right? We want to offer all Americans the opportunity to experience the joy of childbirth and for it to not be approached with anxiety, fear, apprehension, you know, dismay, right? And all those negative emotions that some communities of color bring because they are too familiar with the statistics. And I like to say that we can have joy and justice, right? We can do better, we can improve our system while still extending those families, those birthing people, those women an opportunity to feel and to sit in that joy. They don't have to carry that burden on their own.
Oh, I love that. I love that joy and justice. You know, it would be interesting, Congresswoman, for you to you know, I'm a researcher. I tried to get you to be a researcher.
You did.
You didn't, but whatever. But it would be interesting to see the impact that the omnibus bills, passed or not passed, had on local and states, local organizations and states.
Oh, yeah.
When I think about what's happening here in Philadelphia, for example, we have a major foundation, the Independence Blue Cross Foundation, who centers their new strategic plan. And they've always centered on health equity, but now they're making it prominent. They're making one of their target areas maternal morbidity and mortality.
Mm-hmm.
Our own health system here at Penn Medicine, as a way of addressing diversity, equity, and inclusion, have put that front and center
Yes.
with metrics and holding people accountable for. Our former state of Michigan had, our home state of Michigan also had some bills at the state level. So, you know, congratulations to you. I mean, what impact, but somebody should be documenting
Yes.
the impact that has. There's efforts in New York City from the federal trust trying to look at investing in the fourth trimester. Someone really should be taking a look at that and documenting its impact. So when I talk about lessons learned, I mean, I'm thinking about what's going on now in relation to maternal health and what we're anticipating to be the overturning of Roe v. Wade.
Yeah.
And we see, I think, as I heard you the other day, as you were talking about on the House floor, a warning to all of us here to say this is more than abortion. This is about women's rights. And I think you said, make no mistake, this is just the start.
Right.
Issues around birth control, same-sex marriages are coming up next. So paint the picture that you see for us and help us think about what we can do as academics, as researchers, as practitioners, as students who care not only about women's right to abortion, but women's rights to make decisions over their bodies, to what's going on in all of these other realms that you identified. So.
Yes. So about 10 days ago, I think everyone watching knows that a leaked draft Supreme Court opinion on a Mississippi abortion ban case was released, with an author being Justice Alito, describing a forthcoming Supreme Court ruling that would overturn Roe v. Wade. Now, this would be the first time that we've seen a constitutional right taken away in this country. It would be obviously immediately impactful in states across the country who have already begun passing extreme laws. And I just have to lean in here to ban abortion. In some cases, most recently in Oklahoma, at the moment of fertilization.
Like you can tell when that happens.
Right. And they are seeking to prosecute and put in jail the healthcare providers involved in not only offering the abortion care, but providing counseling and information to their patients who are seeking accurate healthcare information to empower their own decision-making. So the stakes could not be higher. This is not a drill. This is real life. And over the next 4 to 5 weeks, we have an opportunity to make a plan for action. We as voters, as clinicians, as researchers, as leaders have agency, right? This is not something that has to just happen to us that we then complain about, accept, or whatever, right? Like we can do something. And I think that that's really what I want to emphasize. You are right that there are wide-ranging implications for this draft decision, including the Loving case, which deals with interracial marriage, same-sex marriage. There's even implications for Brown v. Board of Education that we are anticipating. And so this would have huge impacts across our society. I want to emphasize that, this is not enforceable right now. So if folks need their health care, they should get it, but we should be eyes wide open right now about, plans to take. I live in Illinois. Illinois has been the beacon of reproductive freedom and access to healthcare in the Midwest. And we are already seeing adjustments being made across our state in anticipation of individuals traveling to Illinois to access healthcare. But we know that these threats to providers, these radical Republicans who are seeking to put women in jail is a real thing. And so I am hopeful that we are going to see strong statements and action coming from the Biden administration to reinforce some of the protections and rights that we have as American citizens, for example, the right to travel throughout the country for whatever reason, to reinforce the safety of medication abortion in the face of, awful and viral disinformation campaigns that spread so quickly on the internet. We need to make sure that our federal agencies are being clear about, the options and the safety of those options that people have. And then, we ask that the American people go and vote in November, because who we elect to write the laws matters at all levels of government. And so, it doesn't matter if you live in a place where you might not have, a key Senate seat up. That's okay. It's important to vote because your state level officials have a lot of power in this context. And so there's an opportunity for all of us to make our voices heard at the ballot box, to elect leaders that protect our right to bodily autonomy, our reproductive freedom, and our decision-making.
So, Congresswoman, I'm struck by your comment about do something. And I think I see many clinicians, students, faculty here wanting to do the something. So the something, you've said, get out and vote. And of course, that's one of my mantras, but that seems so far. And
yes,
voting and what else? What else
yes.
can we do that might make a difference in terms of our elected officials hearing us, in terms of how we talk to other people about
yes.
this? I mean, abortion can be a very divisive issue, but this is more than just abortion. And
yes.
It's so much more. So what is the other something that you might suggest that we use our own agency to help inform others as well?
The other piece of this, as clinicians, as leaders in healthcare, we can be voices of authority on this issue, which means that we need to be comfortable speaking to the media about it, to be speaking clearly to the communities that we serve about the options, and to be willing to, within your scope of practice and the state laws that apply to you, make sure that you are helping people get the health care that they need, and directing folks to safe resources. I think that is going to be so important for the healthcare providers. We know that there are, obviously, like abortion funds and, active folks in the nonprofit space. And if you want to partner with one of those types of organizations, I think that they would welcome that energy. But I do want to, because I'm talking to Penn and I know the level of expertise that your students and colleagues bring, I'm going to really lean in on this public communication space. Being thought leaders are one thing, right? And talking to each other through journals and through, professional societies and associations are important. But communicating to the public is going to be key. And there's an opportunity for healthcare systems, for institutions to be leaders. And while, I think some people are hesitant to run towards issues that they might see as divisive, what we are talking about will set women back decades in terms of economic progress, equality in society, and the opportunity to advance, adjacent opportunities like childcare, like paid leave, right? And I see it all kind of connected, like our maternal health work. And so if you're going to be a champion with us to save moms' lives and end maternal mortality, to me, it's not a stretch to be a champion with us to preserve our access to reproductive health care.
Great. And I think with that, I'm wondering, are you thinking about extending, perhaps not bills, but the focus? Or since there was so much support for the momnibus bills, thinking about what added protections you might include as part of this Mom to Bus, since you've got, such strong support here.
Yes. So in the Congress, in the House, we passed a key piece of legislation, the Women's Health Protection Act, also known as WIPA, which would enshrine Roe v. Wade into law. We passed that out of the House in 2021. And the Senate has attempted now twice to take it up this year, but has been blocked by the filibuster, which is a procedural mechanism in the Senate that requires not a majority of senators to affirm that something can end debate and come to the floor, but that a 60-vote supermajority. And so this has caused Senate dysfunction. And so right now, the legislative pathways are more limited because of this procedural issue. Now, this is the same filibuster that's blocking us from having the Equality Act be signed into law, that's blocking the $15 minimum wage. It's blocking comprehensive immigration reform, right? This is the same filibuster that's blocking our voting rights from being signed into law. It's blocking our ability to end gerrymandering and getting dark money out of politics, right? It's the same procedural tool that is blocking our ability to stand up for working families in this country and to advance key legislation that is so meaningful. Our climate-related legislation, hello, it's all being blocked because of the filibuster and the supermajority requirement. So my energy right now is not focused on, creating and advancing legislation necessarily out of the House, because we need to be focusing on interventions that can be enacted, that can be in law, or funding that can be available to the American people, versus policy changes related to abortion care. This is what I'm speaking of, that would be stopped by this filibuster procedure. So it is a hurdle. The way that we overcome this hurdle very explicitly is we need to elect 2 more pro-choice senators in this upcoming election. And those 2 new senators would need to be willing to vote to remove the filibuster. And that's how we make this change. So my time horizon for legislation would be, unless, the 2 senators, I think everybody knows what I'm talking about, would be willing to change their position on the filibuster between now and whenever this calendar year. The soonest opportunity for legislative action would be in January of 23 with those 2 new senators in place.
I'm not sure if you're painting a hopeful picture for us, but I think that's what the reality is. And I think it certainly emphasizes for all of us here, as we're changing Senate leadership, how important that vote is here in our Commonwealth. I have two questions, and I think they're a bit related. Maybe one's a follow up here, and then I want to change subjects or shift in a little bit direction. But I think the question is, how can clinicians move towards policy work in the area? Again, there's a passion to doing that, and so. Yes. What suggestions? It's like, hey, I don't know how to do that. So, what suggestions? How can we best use our voices as clinicians and researchers to advance this agenda, or any agenda?
Yes. So you don't have to quit your job and spend 2 years running for Congress to be impactful, although we would welcome you doing that, because we need more healthcare folks serving in the Congress. But you can serve from home, right where you are right now. One of the things, lessons from COVID that I think the American people have come to appreciate is that everybody now knows they have a health department. They know who runs their health department. They're very familiar with that person. They may have strong feelings about that person's leadership, but they know who they are and what they do. Well, guess what? That health department has an oversight board. Maybe it's a county board, maybe it's a board of health, maybe that board is appointed, maybe you run for election. Maybe in that election, you're a partisan candidate, but perhaps you can run in a nonpartisan way. My point is, all of us need to be serving on our oversight boards over our local health departments at a baseline level. You can run for your county board if you're not in a city, for like Philadelphia. I don't know how much it costs in Philadelphia, but where I live, you can run for county board for less than $5,000. Okay. And guess what? Your communities want to invest in your leadership. They want to hear from you. They want to support you. You know why? Because you're qualified to do this work. and you're bringing your expertise. Now, I know that a lot of us say, oh, but I'm not political. I'm not political. I just want to be involved. I want to solve problems. Or we'll say, you know, I may have a personal political ideology, and I'm uncomfortable working with those people who seem to have the most enthusiasm for my clinical issue, right? There's a real dissonance there. You might be a conservative nurse, but see that all the energy for ending a disparity or funding research, for example, is on the Democratic side. And how do you reconcile that? What I tell people is you can be involved without changing your core values. You can be involved and work in close partnership with people that you never vote for. The key is not to opt out of being involved. Because when we step away, our communities suffer because they need to hear our best feedback and expertise and our ideas for solving these problems that have been longstanding and impact everyone's lives. The last thing I'll say is that there are many, many, many opportunities for federal appointments, advisory boards, to full-time jobs that pay. Okay, and there are opportunities for you to seek those appointments. And you can be in touch with your member of Congress or your senator to get pointed in the right direction. You can be in touch with your professional association who can help connect you with opportunities to be a witness or to offer written testimony that can nominate you for certain key positions, right? I think there are many avenues to advance your leadership and policy. I think what's been holding healthcare providers back in particular is this idea of it being political and that fear of being involved in the conflict or the perceived conflict that is politics, I should say, or the time commitment. And it can fit into your lives very seamlessly. And I think you would find it to be tremendously rewarding seeing your influence at scale.
Great. And FYI, I see a number of our government relations staff on the call here. So I think for those of us who are interested in addressing policy work, I think having convos with them and again, seeing what opportunities there might be for service, for testimony, for a number of different things. So I'm going to make a little bit of a shift. A couple questions coming in relate to this. Congresswoman, I think one of the things that I'm so impressed with your leadership about is that you make no bones about that you're really looking to science as a way to address and to formulate policy. I don't know how much of an anomaly that is in Congress, but I think what advice would you have for us as researchers? And these are what questions, some of the questions relate here is either how can we as researchers help translate or communicate what we're looking at in ways that would support the work that you're trying to do in the policy arena?
You know, personally and my staff, we read, journal articles. We are always looking to the evidence for suggestions for new bills to draft and policies to adopt in order to save lives, save money, or to scale up programs and interventions that work. And we have found a number of great ideas from these articles. One that I can think of is the Protecting Moms and Babies Against Climate Change Act, which is in our omnibus bill. And that stemmed from a JAMA article that came out in the summer of 2020 describing the interaction of extreme heat and air pollution on negative maternal and infant health outcomes. And we were like, oh my God, how did we miss this? We needed to be part of the omnibus. We saw, there was a journal article describing how if the VA prescribed a year's worth of contraceptive coverage at a time instead of 3 months worth, we would have better adherence and it would save the VA money. And I was like, oh my gosh. So we literally printed out the article, brought it to a hearing, asked the folks at VA, had you seen this? And they were like, no. And they chose not to do it on their own. So we had to write a bill to encourage them to do it, right? I think that for researchers, sometimes they might not think that people are reading it or seeking their input on how to solve these problems that sometimes policymakers created. And I would just urge folks that as you're writing up your findings, write it in a way that a non-researcher, non-healthcare provider can understand those recommendations to make it actionable. I know that oftentimes as we are disseminating our research, that policymaker is not a primary, secondary, or even tertiary audience that any researcher is even imagining would be receiving that information. However, we are here, we are paying attention, and we want to hear from you. And so I would say just like really make it clear in that discussion section what you think we should do. Because I get those digests, Health Affairs, and all these different journals, we're reading them. And New England Journal, like whatever. And want to make sure that we're going in an evidence-based way because we have limited resources in our country. And so if we're going to be deploying those resources towards healthcare interventions, they need to work. And we want to partner with you to ensure that those best interventions are getting to the people that need them. And this is the best way that I know to do it.
So Congresswoman, with that, I mean, we also know that science is not enough to change policy. And I think unfortunately through this pandemic, use of social media, misinformation, trust in science isn't what it, I'm not going to say what it used to be, but I think people are saying, I don't know what to believe. I don't know what to do. And I wonder how that affects some of the policy decisions that are being made. And importantly, how we can help as researchers communicate in a way that people understand people understand what the science is, from policymakers to the public. So wondering what thoughts you might have for us on that.
We definitely have to resist the idea or even accepting that science is, partisan, or science is political in a way that, prohibits certain audiences from even entertaining or being open to hearing the findings or the information that our researchers need to share. That's something that's really dangerous that's happening. But I do think that we have, unique avenues and opportunities to connect with the American people and communicate directly. There was once a time when, scientists and researchers and clinicians only talked to one another through these journals and our meetings and, our gatherings together. But now, the American people are used to hearing from leading scientists, and they may feel a kind of way about the personalities. Maybe it's not a good personality fix. I mean, maybe we need some different voices in the mix, but there are opportunities to advance the discussions that you're having in public, out loud, including on social media. We're finding a rise in these influencers, the clinician influencer who's breaking down, what's this bump and is it cancerous, right? And you're doing it in a really engaging way on TikTok and has millions of followers. Or you're on Instagram talking about sunscreen and like the different ways that we can all protect ourselves. Or breaking down the headlines. And people are excited to engage with that content. And I don't think we should be scared or shy of doing that. And just because something might be momentarily perceived as controversial doesn't mean it's wrong. I served with a wise man, a hero in American history, John Lewis. And John Lewis always encouraged us to make good trouble. Always. And I think that kind of a mindset is something that we need to really embrace in this field, where we're seeing, some public servants with incredible expertise and a legacy of addressing, HIV to COVID, like Dr. Fauci. Someone like Dr. Fauci just get beat up, which is just like outrageous. And yet it's serving as a deterrent from other people from stepping forward. I don't think we should take that lesson from COVID. I think we should take the lesson of everybody in America knows who Dr. Fauci is. Everybody in America knows who he is. And even if they have a strong opinion about him, they are hearing him. and what an advancement that is for our country and for the scientific community. And let's not let that pass us by. Let's be encouraged and energized about it and lean in as we have opportunities to do so, to communicate with the American people.
Great. I'm just looking at the questions in the box, and there's just a couple simple one. One simple one is, what type of county board should we participate in? I bet you would say anyone.
That's right, anyone. So you have, okay, if you live in a state that has counties, which you probably do, then there is a county board, county commission. They might call themselves aldermen. They have different names, but it's the same core function. Those folks are either elected in partisan or nonpartisan elections, or appointed, which is a political process where maybe an executive level person appoints those people. Either way, you should be on it. And you can just look at your local government and figure out who's in these positions. And I bet you will be like outraged. So like, this guy's in charge, what? I could do better. Yes, you can. And you should do it.
So this might be a harder question here, but you talked a little bit about structural political reform and the filibuster.
Yes.
What else is broken there that needs fixing on a structural level?
Okay. So, I think we need a Congress that looks like the American people. When we think about the first days as a new nation, right? Who were the folks that were legally able to serve in the Congress? Wealthy, white, male, Christian landowners. And that legacy has been with us over the centuries. And that has limited the voices that have been able to serve, reflect their lived experiences, and spotlight problems that can be solved. And so as we continue to lift up candidates who have great ideas and solution oriented and are here to do the work, I think that we will improve both the public perception of the Congress and like the actual work product will be better. To my representation matters point from earlier in our conversation. So I think that that's one thing. We are seeing a new generation of leaders be elected to the Congress. I think that's very exciting. And, the press likes to cover it as disarray or all this drama. But, I think the average American would say that it's healthy to have in an intergenerational workplace, right? People across generations with an opportunity to serve. That power is not concentrated in any, in a group with any one point of view because of their age. And then finally, I would say that, there is a real problem with the wealthiest voices, people who are able to sort of buy their way in. And I believe that we do need to be very serious about campaign finance reform. And that if we can create a system where the voice of the voter is the loudest and strongest and most powerful and most resonant in an electoral conversation, we will be back on track. Whereas right now, because of the influence of the uber wealthy and corporations and their ability to spend unlimited sums of money to influence our political system, the voice of the voter is sometimes impossible to hear. And that's really challenging for our democracy to remain strong in that context.
I think as you talked about the importance of state elections too, there certainly are a number of state structural reforms that are going on that,
yes,
as you're saying, absolutely limit the voice of the voter. In fact, can cancel it out. So I think that's, taking a look at structural components in addition to looking at specific issues. I think paying attention to how we're heard and how we're represented are absolutely critical components.
Yes, ma'am. I agree. And, voter suppression is a real thing. It happens everywhere. It's not just a Southern thing. It's not just against Black people, right? It happens to all of us. And we have to be vigilant. And when we run into those forces of oppression, be clear-eyed about it and seek a resolution as quickly as possible. I think it's so important and so key, not just for your voice as a voter to be heard, but for the health of our democracy. It is essential.
So I think we're getting ready to wrap up. I'm looking at my clock here, five minutes. I don't see David coming in. He was going to warn us. But what I'd perhaps like for you to reflect on, you talked about justice and joy.
Yes.
Tell me what brings you joy to the work that you're doing.
Well, this brings me joy. The opportunity to talk to colleagues and people around the country and say, there's room for you here. There's space for you here. You belong here just as you are. I think a lot of us see elected officials and think that they, it's only for the wealthy and well-connected. It's only for economists or lawyers or, people of a certain educational background or preparation, or it's only for people in a certain phase in life. I started running for office at 30. For Congress. This is the only office I've ever run for. And, you can kind of tell that the Congress was not built for someone like me, but it doesn't mean that I don't belong there. And it doesn't mean that the work that I do is not valuable. And so it brings me joy to be able to share my experiences with you in the hope that it inspires you to take action. I think, I'll speak for myself. I used to think that there was somebody with a plan someplace else that was going to come in and save us from, those worst instincts that sometimes we have as the American people, right? The ugliness, you all know what I'm talking about, that somebody's going to save us. What I have learned is that we have to save ourselves, and that it takes the active participation from all of us to do that. And we don't have to be perfect. We are not cookie cutter anything. We can bring our full selves, our full lives, our full personalities to our work and still have tremendous impact.
Well, Congresswoman, I want to thank you for the joy that you bring us. You are such an inspiration personally in terms of how you inspire all generations to become active in the political process. You affirm to us researchers and scientists the importance of our work, to the work that you do. And I think you bring us joy in our ability to work with you to address issues like maternal morbidity, mortality, and all the things that you do that are so important to us. So Congresswoman, you are joy. So many thanks for being with us. I think David has the last words here.
Yeah, so thank you, Congresswoman Underwood. Really an inspiring story. And I think you give us a lot of optimism about what can be accomplished with strong leadership and health policy. I'm a little worried you convinced some people on this call today to maybe quit their jobs, but in all seriousness, what I did hear you say is don't opt out of being involved. You can work with people you don't vote for, which I think is an important message. And your voice and your research can matter. And I think you did just end our week on a very high note. So I really want to thank you for that. And do hope your story makes everyone on this call feel motivated to engage with the policy process to make improvements to health in the country. And Dean Villaruel, thank you so much for leading this conversation. Thank you again for joining us, and we look forward to seeing you back at future LDI events.